I had the privilege today of making a presentation on a review of the evidence of community-based approaches to improving reproductive, maternal, neonatal, and child health. And in the course of all this, we have reviewed in total probably some 1,500 or 2,000 articles. And we have a number of publications that are coming out of this. But I wanted to briefly summarize some of the key themes that came out of our work. The first thing is that there are many interventions that can be effectively delivered at the community level by community-based workers, volunteers, and the number of these is growing. I don't have the time to go through all the interventions that can be delivered at the community level, but it is safe to say that virtually all the ones that are important can be delivered there. The number of interventions that have to be required in a facility or a hospital are relatively small. And there are some very exciting new interventions that have come out in recent years. One of the ones that I'm very excited about is misoprostol, which is a tablet that a woman can take after delivering birth at home that causes the uterus to constrict down, and it greatly reduces the chance of postpartum hemorrhage, which is the leading cause of maternal mortality. So a very simple intervention like this is now being shown to be very effective in reducing maternal mortality in places where women don't have the ability to deliver in a facility where there's the capacity to manage hemorrhage. Another very simple intervention that's come online recently for application in the field is the use of chlorhexidine, an antiseptic solution, Physohex, some of you may know it as, but put on the umbilical cord after a newborn arrives on the scene, and it reduces in some settings neonatal mortality by as much as 25%. A very simple intervention applied in the home through a community-based delivery system. So there are many of these, whether we're talking about the diagnosis and treatment of pneumonia, the leading cause of death among children, whether we're talking about community case management of malaria, again, one of the leading causes of death in Africa, whether we're talking about the prevention and treatment of malnutrition. There are very specific interventions that have been developed that are very effective at the community level, exclusive breastfeeding, on and on. So there's a whole literature that is involved in examining the effectiveness of individual interventions. Community-based family planning is another important one that has been known about for a long time, but still has a long ways to go in terms of really achieving the kind of coverage that women want and that we need in these low-income settings. So we have a vast array of specific interventions that can be delivered by community workers if they're properly trained and if they have the appropriate supervision and access to the commodities they need, the medicines in particular. But these are challenges in low-income settings, and so getting the coverage of these interventions up to very high levels is one of the great needs that we have in low-income countries. I also reviewed the evidence of integrated programs that are in operation for a longer period of time. There are not many of these, but there are a number of them that have very impressive results. A lot of the literature that I reviewed is based on evaluating a single intervention for a short period of time in a relatively ideal field setting that's run by a research project or a very high quality NGO. And so I think the evidence of integrated programs that have been operating for a long time and their impact on maternal and child health is terribly important. One of the most exciting of these is a relatively recent one that I talked about in my presentation this morning. It's the Manoshi project that has been developed and implemented by BRAC in urban slums of Bangladesh. And this project now reaches 6.8 million people. And they've documented a major decline in maternal mortality as well as in neonatal mortality through a program of home visitation with community health workers and the development of birthing huts right in the slums nearby to where people live, and access to referral services. So I think that this kind of approach in which community engagement was developed, a census was made of all the households, visits to all the households were made, and the community became a part of this process. I think these kinds of approaches are clearly the most effective in terms of improving population health. I talked about 4 different countries where dramatic improvements have been made in improving maternal and child health, all of whom have very strong community-based programs and strong community health worker programs. These are Bangladesh, Nepal, Ethiopia, and Brazil. And they all have large-scale community programming that I think can be emulated by other countries. So then I talked about an effectiveness review that I've been a part of, where we looked at 467 studies or other assessments, evaluations in which improvement in child health was achieved through community-based approaches, and we looked at the ways in which those programs achieved that result. And there were four or five different themes that are important. First is that there are 4 basic delivery strategies through which these results were achieved. One is home visitation, one is community case management of mainly diarrhea, pneumonia, and malaria. A third one is what we now call participatory women's groups, getting groups of women together and giving them motivation, empowering them. Fourth one is the provision of outreach services by a mobile team that's based at a peripheral health facility. So I think that's an important finding. So we need to develop those capacities in community health systems. These programs had a variety of ways of engaging the community as a whole by meetings with the entire community, meeting with the leaders of the community, having community-wide mobilizations of one kind or another. And they also had a variety of strategies for meeting with subgroups within the community, groups of women particularly, that led to their effectiveness. They also had unique educational approaches, skits, dramas, innovative ways of conveying messages, songs that engaged the community in the process. They were frequently involved in strengthening the health system for its outreach services, provide training for peripheral healthcare providers. So that was a frequent intervention as well that made these projects successful. And then finally, there were a whole variety of ways of using the community to develop the project implementation plan, innovative surveillance schemes, whether they were vital events registration, knowledge, practice, and coverage, household surveys, innovative approaches to designing and monitoring the effectiveness of programs. So these were common themes that came throughout all of these projects in which we reviewed the effectiveness of programs for improving maternal and child health. I've also been able to say a few words about a large document that we're just releasing this week on the effectiveness of large-scale community health worker programs and challenges these programs face in expanding and improving their quality. So this is a document that will be on the MCHIP website in another week or so. It's 467 pages long, has case studies from 12 different countries, an extensive appendix, but different chapters on the challenges that large-scale health workers programs face. We talk about the history of it, national planning, financing, engagement with the community, training, designing roles, and a whole set of issues. So it's an exciting book that I'm very happy about. So I think the bottom line in all of this is that there's an amazing amount of evidence out there about how effective community-based approaches can be in improving reproductive, maternal, neonatal, and child health. And we need to think of the community as a resource for improving health, not just a passive target for receiving our services. I think that's one of the key themes. And so in order for health programs to achieve their full effectiveness in the future through community-based approaches, we need to adopt the kinds of approaches for engaging communities that many of these projects have. And I think it's an exciting future for all of us working in this field to apply all the lessons that NGOs have learned in their own individual ways in smaller projects and applying those at scale through government-wide programs to achieve the impact that we know can be achieved through these interventions and through these community-based processes and through the full engagement of communities in helping them to improve their health.